Indeed. Thank you, Jackie. Good morning, everyone. Jackie said, I'm Gary Hipple, Assistant Director, Children's Services here in Wandsworth. And I'm talking about morning hunger in our local authority, what's driving it, root causes that we're seeing, and why it matters across education, health, and council services, and how our partnership with Magic Breakfast isn't just because they're lovely people to work with, but also for us, a practical, evidence-based response. Next slide, please. So the start of this for us recently has very much been around the work of our Cost of Living Commission, looking at all factors affecting poverty in our area. And the Commission was very clear that food insecurity didn't sit neatly in any one service area at all. Just as Ben was talking about, it cuts across education, health, housing, and employment. And for children, crucially, it affects them in ways that are often invisible, as lots of us will know, until they show up in their behaviour, their attendance, and their learning. So next slide, please. This is a slide about illustrating some of the work of that commission, was brought together partners from all different sectors and areas of our council to then get to some recommendations. So next slide. So what the commission kind of was very strong about in its messaging was that schools are one of, if not the only, universal service that children access every day. So it makes them uniquely powerful as places to intervene early and fairly. And that's not that schools should carry the burden alone. We're really clear on that, but because they're trusted places, they're consistent, and they're embedded in all our communities. And I'm sure all in the session are aware, for children, food insecurity shows up most sharply at the start of the day, doesn't it? If a child arrives at school hungry, everything that follows is just much harder. Concentration drops, emotional regulation is harder, and things that are relatively minor, small issues can escalate really quickly. And teachers and support staff in our schools are asked to manage the impact of that hunger before learning's even begun. So when we talk about breakfast here, we're really talking about early intervention, prevention, and making sure that our children are ready to learn. So breakfast provision, as we know, really matters, and it reaches children before hunger turns into crisis elsewhere in the system. So what did we do out of that recommendation? So next slide, please. One of the outcomes was the setting up of a school's food strategy, looking at how the commission's work and their recommendations could be practically fed down into schools. Next slide. That strategy then committed us to improving in a number of ways, breaking that down into some of the obvious ones like food provision and food education, sustainability, but also most importantly, that first one, food inclusion, making sure that we knew the children that we were trying to target, that needed most of our support. And we've done an awful lot of work around auto enrollment for free school meals to make sure that we find more of those children. We found in the past couple of years 1,100 more children in our area eligible for free school meals by doing that auto enrollment that hadn't been identified before, and that's allowed us to intervene at a strategic level much more effectively. Next slide, please. So moving on to kind of morning hunger itself. As is in chiming with what Ben said, it's structural, it's not behavioral, it's not about parenting choices, it's not about families not caring, and it's not limited to a small number of households either. What we know and what schools tell us consistently is that families are really under pressure. And in London, deprivation isn't evenly distributed. We've got hidden hunger in schools and communities that aren't known as areas of high deprivation, but have significant numbers of children arriving at school hungry. In Wandsworth here, we've got areas of great wealth, but sitting alongside areas where 40 to 50% of children live in poverty after housing costs, even when parents are in work. We've got over 3,000 children in temporary accommodation, which Ben touched on, and housing costs alone can double child poverty rates compared with before housing cost measures. And because rent and temporary accommodation costs take up so much of a family's household income, food often becomes the most flexible budget item. And breakfast is often the first meal that gets reduced or skipped when money runs out at end of week or end of month. Next slide, please. So a defining feature of hunger in our area is, again, back to what Ben said, and we kind of fall in line with the stats, is that most of the children living in poverty in our area are in working households. Over 70% of children in poverty have at least one working parent, but often in a low paid, insecure, or 0 hours roles. And so we've got a lot of families that work in hospitality, cleaning, care, and the gig economy. So that then leads to early starts for those families, long commutes, and shift work, which means parents may leave home before breakfast. They're not around to help with that food preparation. If they do it, is often rushed and skipped. And some families will expect their child to eat at school, even if the breakfast provision in school isn't suitable for their child. And all of those things directly increase morning hunger, particularly we're finding in primary age children. Also, we're saying the short-term income interruptions are a major trigger for morning hunger. So delays in benefits and benefit deductions or sanctions are strongly associated with those families then seeking out food bank use, and even income shocks significantly increase household food insecurity, especially for lone parents. Lone parents are disproportionately represented in our free school meal eligible data. And obviously, we know that there's been a lot of changes to universal credit recently, and a lot of our households who were on housing benefit have been moving across to universal credit, and that has pushed some families locally into food shortages. Again, forcing families, if they've got to prioritize food, they'll probably prioritize the evening meal over breakfast for children. I mentioned temporary accommodation, those 3,000 children that are living in temporary accommodation in our area, hostels or overcrowded flats, and they often lack adequate kitchen facilities, even storage for food, and a routine that would allow for meal preparation. So again, it makes consistent morning meals difficult for children moving between placements or even schools if they're having to move around. And even those schools that have got traditional breakfast models, they don't always work. Many schools work incredibly hard to support families, including through breakfast clubs and wraparound support, which I'm sure lots of you are familiar with. But some models have unintended barriers. So any paid provision obviously excludes some families. Targeted provision can create stigma, and provision that arrives on children arriving early doesn't always reach the children who need it most. And we think about that connection into attendance and punctuality issues. So even where breakfast exists, hunger can still go unaddressed. And so that's where our design of our Magic Breakfast Partnership provision really, really matters to us. So next slide, please. So our response in terms of how Partnership Magic Breakfast works is designed to tackle those root causes directly. Firstly, by universal access in our supported schools. We work with the schools in quite a deep way. Shout out to our fantastic engagement partner from Magic Breakfast, Lucy, working with our schools to see what type of provision in the classroom works best. So it's available to all that need it. No forms, no eligibility checks, no fuss really for parents. That removes stigma and ensures children who need breakfast most are not signaled out. But it also guarantees nutritious provision. So supplies, the food's consistent, things children will eat, and schools can deliver it easily every day. So hunger is addressed reliably in those schools, not just when families are able to manage that at home. And then third, flexibility in the partnership. So schools choose what works for their community, not us and not anyone else. They know the children, they know the families best. So working with them, they'll decide on whether it's a classroom breakfast for a soft start, grab and go at the gate, a more traditional breakfast club, or provision for latecomers. So we flex that model to whatever fits the school best. That flexibility is critical to us. It allows us to respond to real life, really, not what we ideally would want to see. So next slide, please. So targeting impact and accountability. While sort of access is universal within schools, the partnership itself is very targeted. So we're prioritizing schools where food insecurity is most likely to be a barrier to learning. This ensures that the resources are directed to where they make the greatest difference. And our evidence so far is pretty consistent. Schools report improvements in children's concentration, their focus, their behavior, and ultimately their readiness to learn. And these benefits are particularly strong for our disadvantaged group. Our pupils experience socioeconomic disadvantage. So from a system perspective, this really matters. Reducing hunger early on reduces pressure on teachers, we hope, on pastoral teams, on health services, and on family support. And importantly, our partnerships and there's accountability between us. The funding agreement between us sets clear expectations around delivery, reporting, and monitoring, ensuring that the program remains focused on, it has a hunger focus rather than drifting into anything like a childcare substitute. It also allows schools that may have other provision to work alongside it. So in schools we might have multiple types of breakfast provision, but we've proven and shown that they can work together. So next slide, please. And then Magic Breakfast isn't a standalone initiative for us. We started off talking about our wider strategies, and this is one part of that. But it is very much a practical expression of how we work across education, across health, and with our council services to tackle that inequality and equity early. So by addressing that morning hunger, again, just reiterating, we're supporting learning, we're hopefully protecting the well-being of our children, we're reducing pressure on our schools by working with them and not leaving it to them to do, and giving children the best start to their day. And our evidence so far is showing so far it's working. So if I finish with our last slide, our impact report, we're serving over 5,500 breakfasts a day and crucially reaching a really high number of our disadvantaged cohort in the programme. And one thing just to flag up there in the top corner, we are seeing an expansion of our holiday packs as well. So looking at not just in term time, but what we're doing out of term time as well in the holidays. And that's becoming ever crucial to us. And a current piece of work we're working on is how we might expand our use of holiday provision and partnership with Magic Breakfast as our one of the programs that we provide from the Household Support Fund is ending, which provided food vouchers in the holidays. That's ending. So we're looking at how our breakfast provision and holiday packs can fill that gap in upcoming holidays. And that is our story.